awareness.
Thank you for having us.
I do appreciate it. This is obviously a topic that is very near and dear to women's hearts. I think the awareness has really increased over the years of breast cancer. I think we're moving mountains. Would you say that, Dr. Mendez?
I concur.
And Dr. Carcas?
Absolutely.
I think women are more aware of the mammogram and what they need to do. We're going to be talking about how breast cancer is prevalent. And Dr. Mendez, I wanted to go over some statistics that I think people should know. There's no surprise here, but we're just going to show them to you. Most common cancer in women, correct?
Yes, it is, and it is the second cause of cancer death in women. Also, it is the second cause of cancer death in other races and ethnicities. And it's the most common cause of cancer deaths in African American women.
Okay, and I saw there also Hispanic women. Any reason why Hispanic and African American?
We think it's related, as I will be talking about, pertaining to the biology of the tumor. So that type of tumor that they get.
All right. Has breast cancer, Dr. Carcas, always been such a common cancer in women? Because my mom will tell me, for example, you know, when I was in Cuba, before I came over, you know, with the revolution and Fidel Castro, she goes, we didn't hear about it. We didn't talk about it. I didn't know anything about breast cancer. My friends didn't have it. But yet now it's like, it seems like in the last, let's say, 2 decades, I'm going to guess, it's been like really prevalent.
So although the prevalence appears that it is on the rise, I think that we're really doing a better job of diagnosing early. So I think that that's probably what people are noticing, is that we're diagnosing the disease more often, and people are living longer so that you're able to see that this disease can manifest over that time period.
And would you say, go ahead, Dr. Mendez, I'm sorry.
And also, we're talking about it.
Right.
Because we have the awareness, the education.
Before we did it because it was too embarrassing, probably.
Correct. And we have now screening modalities and just the awareness pertaining to breast cancer. So it seems that there's more of it, but as Dr. Carcas said, it's about the same.
All right, so just interject if you can. Number of diagnoses, is it on the rise or is it decreasing? Ladies?
It's stable.
Stable. Same. Comparable.
Yeah. Yes.
All right. Dr. Carcas, I know you are on the board for the Women's Breast and Heart Initiative here in South Florida. Tell us about the organization and what the goals are.
So this organization is an outreach organization that goes into underserved communities, usually women that are somewhere in the 200 to 300% of the poverty line, that are your service workers that might not have government assistance for their insurance but can't afford commercial insurance, that are not getting screened. They don't have the same access to care. So it's a door-to-door outreach, knocking on doors, educating women about the risks of heart disease, the risks of breast cancer, and also enrolling them in programs that might even be able to offer them free screening for those diseases.
Fantastic. So when they're home and they think, well, I can't get checked, I can't afford it, I don't have insurance, you're offering maybe the opportunity to get screened for free.
Absolutely.
Yeah, it's key to remove those barriers, because we know how important that early detection is when we have the best outcomes. So being able to avoid some of those barriers to really improve the access is critical.
Absolutely. I also know, Dr. Carcas, that June 23rd, today is, let me see, the 18th. So in about 5 days, yes, 5 days exactly, it is National Pink Day. I'm actually wearing pink today, and it's coincidence completely, but it's National Pink Day. Tell us what it is. It's not so much wear pink, it's just National Pink Day.
Right, so National Pink Day is just really to celebrate the color, but the Women's Breast and Heart Initiative has kind of taken on the day, or taken over the day, to really raise awareness for their summer breast cancer campaign. The breast cancer is year-round. It's not just October. We hear so much about it in October.
We do.
But really, we want to raise awareness throughout the year. So we're asking women and men and everybody to wear pink on that day, take a selfie, and post it on social media with the hashtag WBHI Pink Day.
Okay, so I'm writing that down. WB like boy, HI Pink Day. What is the WBHI?
Women's Breast and Heart Initiative. Pink Day, so hashtag.
So it could be pink nail polish, pink lipstick, it could be a bow, it could be pink shoes.
Exactly.
My husband has a pair of pink shoes.
Perfect.
Real men wear pink. But anything pink.
Yes.
Which is nice, because you're creating that awareness and you're continuing on. And then we kind of get revved up for October, which is the biggest month for us.
Yes, and we actually took a picture of our whole team last Friday so we can post it on Sunday.
Oh, that's
so it's great,
nice.
Yes.
Do you have your cell phone you can show me maybe in a commercial?
No.
It's a surprise.
It is a surprise.
Okay, I love it. Maybe we'll do that here at the Health Channel. So we'll all take a picture in
Yes.
pink, and we'll post it on June 23rd.
That would be awesome.
Perfect.
I'm on it. Okay, I'd like to take a moment just to remind our viewers that if you have a question for either Dr. Mendez or Dr. Carcas, toll-free number is right there. So easy. And look at the pink background. I mean, can you ask for more? 855-796-4475. Okay, so when it comes to risk factors for breast cancer, as we explain here on the Health Channel all the time, there are some that you can change and there are some that you cannot change. As we say, you cannot pick your parents. Unchangeable risk factors. So Dr. Bennett, let's have these
Yes.
and then we'll have Dr. Carcas do the other ones.
Absolutely. So age, so the older we get, the higher the likelihood of breast cancer, any genetic mutations, race, and your ethnic background. When you have dense breasts, that makes the mammogram less sensitive. So having dense breasts is also a risk factor. And certain breast changes or pathologic conditions that really increase your risk of breast cancer, certain abnormal cells, will definitely be something that we cannot change.
Genes and family history really plays a role, Dr. Mendez, right?
Yes, interestingly though, the vast majority of breast cancers occur sporadically, meaning you do not have any family history, you don't have any genetic mutation, but yet you develop the breast cancer. Only 5% of breast cancers have a genetic mutation associated with them,
Look at that.
and 10% have somebody in their family who has it. So the vast majority, 85%, occurs sporadically.
Look at that. Okay. I'm just curious, real quick, Dr. Mendez. So if your mom, let's say, had breast cancer, when should you be screened? And if you don't have any family history, when should you be screened? When should you be
Yes.
starting?
So we usually look at the age at which your relative was diagnosed with breast cancer. We usually recommend that it should be 10 years prior to the age that your relative was diagnosed with breast cancer. Usually we look at first-degree relatives, your mother, your sister. Those are the most important, certainly your grandmother. So if you were diagnosed, my mother was diagnosed at age 40, I should get screened starting at age 30.
At least a baseline.
At baseline,
Okay.
exactly.
Dr. Carcas, let's do now risk factors that you can do something about. These are things that really you should make an effort, no doubt about it. Being overweight.
Right. So being overweight really. Fat tissue increases total body estrogen stores. So our most common type of breast cancer is hormone receptor positive. So the higher levels of estrogen does increase that risk. Radiation exposure. So if you ever received previously radiation to the chest wall as a child that would have included breast tissue, those patients are at increased risk. Hormone replacement therapy. This is the same as the increased estrogen. Any exogenous or outside exposure to hormone really can increase the risk of developing breast cancer. And then smoking is really a risk factor for almost all malignancies, but so is alcohol intake.
And all of these truly, when you make an effort to either quit smoking or stop, I guess, drinking every day, or, limited, I guess is the word I'm looking for.
Yes.
Or losing, it really makes a difference to lose that weight and do all these things, right?
Really does.
It does.
Research has shown that.
Healthy lifestyle is key to prevent any type of cancer, because we cannot change our genes. So at
Right.
least we need to do whatever we can as individuals to at least maintain a healthy lifestyle.
Exactly. All right. There is something called like a health score for breast cancer. Can you define what that means? How do you find your health score? And there's a breast cancer risk assessment tool. That I've never heard of.
Okay, do you want to tackle the health score?
So the breast cancer risk assessment tool, that's what you're asking
okay.
about, the risk?
Yes.
So really what that's looking at is it's looking at, has a woman ever had a previous biopsy? Did that biopsy show that there were atypical cells, or were they normal cells, or were they precancerous cells? They look also at when periods started or when the first time they gave birth is. And then family history also plays into that, and breast density in some models. It depends on which model you're using. Depending on that, it kind of comes out with a number of your lifetime risk or your 5 or 10-year risk, depending on which model is used, of developing breast cancer.
And the impact of that is, depending upon which model you use, is what recommendations we're going to make for increased surveillance. Are you just going to get your mammograms once per year with your ultrasound, or are we going to need to add something like an MRI to further evaluate your breast? Okay, so if you have enough risk, more than 20% risk of breast cancer, we might order an MRI for that given patient because of their increased risk.
So it really is, how can I put it? It's not like before that it just be a couple questions. You're really looking at a huge summary. Maybe that's what
Yes.
I'm trying. It's almost like a
Yes.
term paper, if you will, of facts, of the history, current, to really make some sort of diagnosis here.
Yes, what we're trying to do is stratify the risk. because not all patients are the same, breast densities are not all the same, and we're trying to stratify the risk so we can better serve that individual patient.
All right. Moving on, we're going to take a quick break. And when we come back, did you know there are different types of breast cancer? When we come back, we're going to hear about different types of tumors and how patients are diagnosed for each. You're watching the Health Channel, All Health, All the Time on South Florida PBS. If you have a question for our experts today, Dr. Mendez and Dr. Carcas, right here on standby for you, 855-796-4475. Check out our website, allhealthtv.com, and check out the new Health Channel app for your mobile device or smartphone. It's free and available at the App Store or Google Play. Stay with us.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for CURE, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
My journey started with one step. I was diagnosed with diabetes and I was on a downward spiral. I use running to find myself, but I also incorporate some of the eating habits that I learned as part of the Florida Blue pre-diabetes program. It just ignited a fire in me. Before I knew it, I was up to 40, 50 miles a week, and I've done 15 5Ks in the last 12 months. I'm not fastest, I'm never firstest, but I finish shedding all the weight, all the bad habits. It's just been amazing. I love being the healthiest version of myself that I can be. The one step became 10,000 steps. Then the one choice became a lifestyle. I'm Rita, and this is my kind of blue.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, All Health, All the Time. I'm Olga Villaverde, and with us today is Dr. Jane Mendez, Chief of Breast Surgery at Miami Cancer Institute, and Dr. Lauren Carcas, Medical Oncologist, also at Miami Cancer Institute. If you have a question for our doctors, please give us a call. Toll-free number 855-796-4475. So before a patient is diagnosed with breast cancer, usually the doctor or patient will notice something unusual. It could be in a self-examination or a mammogram. So Dr. Carcas, let's go through some notable symptoms that one would notice. For example, the first one is the obvious, a lump.
So right, it's really important that women are self-aware, that they know their breast. If they feel a lump, it's important that it is evaluated. Don't just assume it's nothing. Most breast lumps are actually benign and not cancerous, but it's still important for that to be evaluated.
Can we expand just on that lump? Because a lot of people sometimes think it has to be this huge. They tell me like a little pea size.
It can be a
Can you
pea
describe
size.
what we should be feeling?
Anything that's abnormal or new for your breast.
Got it.
Is what it should be. It can be the size of a pea, it can be the size of a quarter, it can be the size of a grapefruit. Women have all different shapes and sizes and textures of breast. What you need to know is how your breast feels. Skin thickening is also really important. If the skin on your breast tissue changes or it starts to dimple like the peel of an orange, that's a really important thing to seek attention and further evaluation for. It's also important to know if your nipple starts inverting. Nipples are supposed to protrude.
Correct.
If they start inverting, that's a really important sign because it could be that there's a tumor on the inside
That's
pulling it in.
Got it.
Exactly. If you have a nipple discharge that's bloody or really just any nipple discharge that is new for you,
Certainly an alarm there.
it should be evaluated. And breast pain. Most breast pain is normal. Most women have breast pain, particularly around their menstrual cycles. So that's not an abnormal finding, but if it's persistent, if it's something that is new and different, it should be evaluated.
Now, I will say with all those symptoms, a lot of women out there are going to be able to relate to me because before, when I used to check myself, I would freak out because I had extremely, extremely, extremely dense breast. So, I mean, I have lumps all over the place.
Right.
So that would freak me out. And sometimes I say, okay, wait a minute, that's not necessarily a lump. So I always have to be cautious about not, going into like panic alarm mode.
And that's why it's so important to know your breast. Most of the major organizations do not recommend self-breast exams because it doesn't impact survival. But really, a lot of women and partners find breast cancers.
Look at that.
So it's important to know your breast.
At 30% of the time, it is either the patient or the partner who feels the lump or who feels the abnormality for the first time. So if you don't know what's normal for you, how can you detect if something has changed? So as Dr. Caracas said, it's critical to know your body so you can detect changes.
Absolutely. There is something called tomosynthesis, and it is a breast cancer screening technology, I'm going to be doing it very soon, that allows doctors to basically see inside the breast more clearly. It's a 3D mammogram that allows for better detection of tumors, especially in dense breast tissue. Take a look at this.
3D uses a computer tomography to acquire images through the breast. So instead of, in the past, we used 2D. It's a single image, and you have the overlap of breast tissue. The 3D tomo has helped us diagnose early breast cancer, which it's what we want. We want to pick up the smallest as we can to save patients' life. It's better for the patient because the cancers are smaller when diagnosed, and it's just the evolution of the technology. Before we use analog, we have to process the image, and the quality wasn't too good. Now and then we pass to digital images, 2D, and now we're just getting better and using computer tomography. Bethesda Women's Health Center is committed to provide the best care for the patients. When they come here, they have the latest technology, and all our radiologists are fellowship trained. And when a patient comes here, they can feel confident they are having the best care.
Just want to remind our viewers, if you have a question or two for the doctors, there's our toll-free number, 855-796-4475. Dr. Mendez, I just wanted you to share with our viewers what you were just telling me now about the difference between the 2D and the 3D. I mean, it really does allow you to see much more, right? You were explaining that to me.
Yeah, so basically what the tomosynthesis does, it takes like a 180-degree view of the breast. So we'll be able, instead of just taking a static image of the 2D, we can actually computerize, go look slice by slice in the 180-degree movement so we can see that 3D breast reconstruction. So it's really allowed us to really detect abnormalities a lot earlier.
And there are some women that, besides getting the 2D or 3D image, they'll do an MRI or ultrasound. Is that correct, Dr. Caracas?
That is correct. So sometimes if you're getting just a regular mammogram, you need the ultrasound to overcome the density of the breast. And those two together can help the radiologist find a little bit more of the nuances that might not be seen well on an x-ray or just a plain mammogram. And then MRI is indicated if a mammogram and ultrasound does not explain whatever is felt or is seen, or for high-risk screening, it would be indicated.
So MRI is not a screening tool, though. So we only reserve it, as Dr. Caracas said, for high-risk women or women who we cannot get an answer just based on mammogram and ultrasound, but it's not a screening test.
Perfect to clarify. Now, we have a graphic to show our viewers. After a diagnosis is made of breast cancer, there are different types of breast cancer. I'll have both ladies take this. So, Dr. Mendez, let's take the first one. Ductal?
Okay. So ductal carcinoma in situ, otherwise known as DCIS, is actually stage 0 breast cancer. So that's the earliest stage in which we can detect something in the breast, and these patients have an excellent prognosis.
All right, and Dr. Caracas, the next one, please, if you don't mind.
Lobular carcinoma in situ is also a precancerous lesion. When you're talking about ductal versus lobular, it's really about the location in the breast tissue where the tumor is arising. Is it coming from the milk duct or is it coming from the lobule? So it's a similar finding.
But this is controversial, because as Dr. Caracas said, it's precancerous. So this is not a cancer. This is a risk marker for the future breast cancer development. So even though the word carcinoma is in it, which implies cancer, it is not a cancer. So it's a difficult concept to understand. So it's considered one of these high-risk conditions that would merit an MRI. So we know that these women will be at increased risk of the development of breast cancer in their lifetime, but it is not actual cancer.
All right, and then Dr. Caracas, let me have you take the last two. Obviously, they are the first and second with the word invasive. What does that mean?
So invasive means that it has invaded beyond the border of the duct or invaded beyond the border of the lobule, which means it's going into that fatty tissue in between those spaces of the breast tissue. Once it invades beyond, it has access to the lymphatics and to the blood supply, which means that it can spread. So it truly is a cancer once it becomes invasive.
All right, and then another part of the diagnostic process will be the staging. Dr. Mendez, if I could have you go to our 3D image wall, if you don't mind. Thank you very much. This is obviously the 3D image of the breast. You had mentioned stage 0 just a few minutes ago.
Yes.
So why don't we start there, and then we'll continue on.
So, the breast, this is area of the nipple, these are the ducts, and the lobules are the structures that look like more lobulated, as the name implies. So this is where the milk is produced. And when it's a ductal carcinoma in situ, is that it's trapped inside of that duct. And the ducts usually transport the milk to the nipple for breastfeeding purpose. So it means that it's trapped within the duct.
All right, and that obviously, Dr. Well, I shouldn't say obviously because I could be completely wrong, but that has not metastasized?
Correct. So by definition, when it's trapped within the duct, it does not have the potential to metastasize or spread because it's trapped. So that's why it's called stage 0.
And when it does metastasize, it could just show us what then happens.
Yes.
Where does it start migrating?
So the first place where the breast cancer spreads to is here in the area of the axilla or the armpit. And that's the first place where we have to check. And that's when we check at the time of the clinical examination. It's important for us to check under the arm because that's the first place where the cancer may spread.
That would be in the lymph nodes area?
Exactly. So it would be here in the area under the arm, in the armpit, otherwise known as the axilla. And that's why sometimes breast cancer may present for the first time there.
All right, thank you, doctor, very much. And then we have to then, or doctors have to determine then the cancer stage. So, Dr.
Yes.
Caracas, let's go over then determining the cancer stage. And I don't think this is it. So maybe we can go to the next one, which would be size and whether it has grown to nearby tissue. We don't have it, but I'm going to go over them real quick, Dr. Caracas. It would be size, whether it has gone to lymph nodes, whether it has spread beyond. The tumor grade, what would that be?
So we'll talk about all of those. The way that we stage breast cancer is off of a TNM staging platform. Tumor node metastasis.
Okay.
So the T takes into account the size of the tumor. Has it involved the skin or the chest wall? So size and its involvement or location in the breast. So that's the T part of it. N is lymph node involvement. Does it have lymph node involvement and how much lymph nodes are involved?
Okay.
Because then that will stratify N1, N2, or N3, which goes along into a staging. And then M is your metastasis. It's basically there are or there are not. And metastasis beyond the lymph nodes is what we're looking for. Anything that's involving the breast or the axilla is going to be stage 1 through 3. Anything that goes beyond that would be considered a stage 4. When you're talking about grade and the hormone receptor positivity, the ER/PR, and the HER2 status, then what you're really looking into at that point is you're looking at the prognostic signs. Those prognostic markers are really important to decide how patients are going to be staged from a prognostic category, not just a size category.
All right, we got to take a quick break, and then when we come back, we're going to talk about the diagnosis for breast cancer and the treatment options they have for each patient. We're going to be talking about these options as well as the importance of using a multidisciplinary approach. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Mendez or Dr. Caracas, toll-free number right there, 855-796-4475. Our website, allhealthtv.com, and our new Health Channel app for your mobile device or smartphone. It's absolutely free, and it's available at the App Store or Google Play. We'll be right back.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing. At that point, I really pushed to get that prescription. My initial reaction when I was diagnosed is, oh my goodness, I'm going to die, and I'm going to leave my 2 young daughters behind. My children, I had no clue how to tell them, and no clue what to say to them. And I said, you know what, why don't I write my own book? So this is my first book, Heir to the Queen, and it's about a little girl that wants to make her mother feel better about being sick and not having hair. So many people helped me, and now it's my turn to give back. If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go and see your doctor, get the mammogram, get checked.
Every year, millions of Americans are exposed to a contagious virus.
What is this virus? It's stigma.
Stigma promotes an environment of shame,
fear, and silence,
which prevents millions of people from seeking help.
But there's good news.
The National Alliance on Mental Illness believes stigma towards mental illness is 100% curable.
So do yourself and everyone a favor.
Go to curestigma.org and get tested for stigma.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful.
And why should you go anywhere when you'll probably feel better just staying in bed anyway?
That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home? And it's care right away, not hours of driving in the car and then sitting in a waiting room. Because when I have the flu, there's only one thing I feel like doing.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. No one should face breast cancer alone. When I was diagnosed 36 years ago, there was no internet, and I had to make a decision with little information. Early detection saved my life. It could save yours too. To learn what every woman needs to know about breast cancer, visit nbcf.org/hope.
Welcome back to the Health Channel, all health all the time. I'm Olga Villaverde, and with us today is Dr. Jane Mendez, Chief of Breast Surgery at Miami Cancer Institute, and Dr. Lauren Carcas, Medical Oncologist, also at Miami Cancer Institute. If you have a question for either of these two experts, you could call us using the toll-free number 855-796-4475. Before the break, we were talking about different types of breast cancer. Doctors, now, when you are diagnosed, how does now this factor into treatment for each patient? And I'll start with Dr. Mendez.
So basically, depending on the type of cancer, there's three main avenues that we have, all part of this multidisciplinary approach. One is surgery, the other one is radiation, and then all the chemotherapy or medical oncology components, which are chemotherapy or the adjuvant endocrine therapy. So depending upon what patient's tumor characteristics are and other medical problems, we'll start the discussion about what each of these options is within those three main brackets.
And I know with Baptist, and I always love to talk about this because I think it's just so helpful for the patient, that multidisciplinary approach. Dr. Carcas, can you chime in on that?
So we actually have a tumor board where cases can be presented, and there are radiation oncologists. Yes. So there are surgeons, there are radiation oncologists, medical oncologists, pathologists, radiologists, geneticists, all in one room discussing cases to find the best approach to that particular patient's care. And you take into other factors as well, not just the fact that they've been diagnosed with breast cancer, but you look at what their comorbid conditions are. Do they have other diseases that might complicate their treatment? So you have to look at the total patient to make the best recommendation.
And Dr. Mendez, I think that's so fantastic because before, patients would have to make an appointment to go see one specialist, then go see another specialist, and then by the next, it's months and months have passed. But here, it's almost like having everyone right there in one room, fighting for you.
Yes.
I think that's great.
You know what, and that's why, it's about personalized treatment in terms of, okay, not one size fits all. And we'll have to put our brains together as specialists and figure out how we're going to better treat this patient to maximize their cure.
As a person, I hope I never have to be in this multidisciplinary, I love you guys, but I don't want to ever have to see you. But I do feel that I would feel more, I just feel more peace, at peace, knowing that everybody is there concerned.
Yes.
That's fantastic. We were talking about treatments. We have a list of treatments that are possibilities, options, and I'm sure as doctors, you talk about this with the patient. Doctor, you mentioned surgery, chemotherapy, radiation, hormone therapy?
Yes, so for those tumors who are hormone sensitive, such as the estrogen and progesterone receptor tumors that Dr. Carcas spoke about earlier, we can offer them this endocrine therapy. And for those patients who are the HER2 positive, which is another receptor that we can check, we can offer them targeted therapy with monoclonal antibodies. A little complicated, but when you have it, it's good to have that treatment.
Does the age of the patient, Dr. Carcas, determine or change your mind as to what treatments? And then my follow-up question is, could you have more than one and combine it, like almost like a two or three ingredients?
Yes, so most people get more than one of those treatments. They get a combination of those treatments, usually at least two, potentially three or more of those treatments. Age does play a role in our decision making, but even more so than age is their performance status and their comorbid conditions. So performance status, you've seen 80-year-olds that look like they're 100. You've seen 80-year-olds that are better than 50. So you have to really take that into account and what you perceive or expect their life expectancy to be when we're making these decisions. But yes, most people get more than one of those, and age, although it does play a factor, it's really important to look at what other conditions that patient has and how well you anticipate they would do a treatment.
Could you just define what you mean by this comorbid and how that would affect treatment?
So comorbid conditions are other medical diagnoses. That might be diabetes, heart failure, or heart disease. all of those other things that can really impact their ability to tolerate chemotherapy, or maybe you would anticipate that they would have more toxicities from chemotherapy, like very severe neuropathy or things like that.
Because there's so many side effects with chemotherapy.
Exactly. So you have to really take that into account when you're making your decision for each particular patient.
Dr. Mendez?
So a good way to summarize it would be, yes, we have all these treatments to offer, but with every treatment there's side effects. Right. So we need to have a very delicate balance between what's optimal to maximize the cure, but at the same time keep the quality of life for the patient. So we need to keep that very delicate balance.
All right, I'd like to remind our viewers, if you have a question or two for our doctors, they are here on standby just for you, 855-796-4475. Like we were talking about regarding side effects, hair loss is a side effect of chemotherapy that can have a significant impact on the psychological aspect of a breast cancer patient treatment and recovery. But there is new technology that can help decrease the chances of hair loss during treatment. That's fantastic. It's called scalp cooling. That's cool. Take a look.
So we are so excited here at the Miami Cancer Institute to have been offering this scalp cooling that a lot of women with breast cancer are really waiting for. So cooling cap is a method of cooling the scalp down to decrease the chances of hair loss during treatment.
Cancer is such a devastating disease, and especially for women with breast cancer. The distress that a woman goes through at the thought of losing their hair is tremendous.
It's not as uncomfortable as I thought it might be. It's definitely cold and the cap is snug, but so far, so good. The Miami Cancer Institute has been wonderful. Everyone here has been so informative and comforting. It has been an incredible experience.
It's our goal here at Miami Cancer Institute to treat the whole patient. You have to treat the body, you have to treat the mind, and you have to treat the spirit. And again, body concept, self-image is very much part of the mind and the spirit.
It's so true. It's almost like talking about wellness, the body, the mind, and the spirit. I wanted to talk, just amazing how technology has evolved, and no doubt it's still very difficult, but these treatments are a little bit more tolerable, Dr. Mendez?
Well, and we've learned also what medications we need to give the patient to kind of subside some of those side effects, because quality of life is really important. So, you know, I know Dr. Carcass, in preparation for chemo, gives us many medications to prevent side effects as she does to treat the patient.
And to help patients after having a mastectomy, there is a special boutique, I find this to be so fantastic, at Miami Cancer Institute that offers patients a wide range of beautiful bras and other clothing. Take a look at this.
I came here for a doctor's appointment, and after I finished my appointment, I came downstairs and I happened to see the store. I came in and met the lovely Tanya.
When she first came in, she was just looking at the wigs, and she mentioned that she had a mastectomy 9 years ago, and that she was having a hard time finding bras. So that's when I showed her the bras, until finally she found one that she loved.
Most people don't realize this, of how difficult it is to find bras, and for a lot of people who need other devices to find things for breast cancer patients.
And just to see the patients, you know, they look themselves in the mirror and they're like almost crying, saying they feel back to where they were before the surgery.
I'm very happy I found the store. It's really helped me, and I think it's very important that people who are going through chemo and cancer treatment know in this building, where they come anyway, there are wigs available and things for mastectomy patients, bras, and other things. I think it's important that people know about it.
So important. And that, I believe, is in the lobby area when you walk into Miami Cancer Institute?
Yes, right at the lobby.
Do your patients come back and say, you know, I went to the boutique and it's just, it's not that it's a fabulous place, of course not, but it just made it a little bit easier?
Yes, you know, and the personnel, as you could see, they're very caring, very compassionate, they really engage the patients. So it's really making the best out of the experience.
Dr. Caracas, do you think it helps also just with the, again, that body image? Psychologically, it's very difficult. Spiritually, it's very difficult for a woman. But to have all those, again, that multidisciplinary approach where you have everyone there on your side. It's almost like a cheerleader, you know? We're here for you.
I think that it definitely does. And a lot of times the women who work in those boutiques and in that boutique are affected by breast cancer as well. So they've already walked in those shoes, so they can give a little bit of extra support to the patients.
So the personnel there at the boutique
oftentimes have been affected by disease.
How much of a difference does that make, Dr. Mendez?
I think when you walk the walk,
you can talk the talk.
Exactly.
That's great.
So, you know, they can empathize with the patient and they can really relate. So I think that's really important.
There's no doubt they say that, you know, just having great doctors and great outcomes is fantastic. But I think just having a positive outlook is just most of the battle.
You know what, that's the first thing that I tell my patients. I explain all the treatment options that we have, but at the end of the day, I tell them the most important in this person is you and your positive attitude and your inner spirit. That's what will drive you. Is the most important treatment of all.
Amen. All right, coming up next in our last segment, a great hour this has been so far. We're going to be talking about other considerations when deciding on a treatment plan, such as whether or not a patient needs to preserve her fertility. A lot of people are doing that as well. You're watching the Health Channel, All Health, all the time on South Florida PBS. If you have a question for Dr. Mendez or Dr. Caracas, they are here for you, 855-796-4475. Visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7 and download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play. We'll be right back.
A double lung transplant is probably the most difficult surgery you can get. Being able to breathe, it is a feeling that you want to rejoice instantly. I can walk, I can talk. When I get up in the morning, I always thank the donor. I thank the surgeons. I thank Florida Blue because they were so helpful. My case manager, she was the one responsible for getting liquid oxygen that I needed when no one else could. It's what kept me alive. My favorite time is to walk during the sunrise because it reminds me of a new beginning. I'm Ed Henry, and this is my kind of blue.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge, and your help, we can save them all.
Making some lifestyle changes, you can help prevent or delay prediabetes from turning into type 2 diabetes.
9 times out of 10, people are just not eating enough vegetables. Fiber is one of those things that we don't talk often enough about, those green leafies, whole grains, and fruits. It actually helps to make you feel fuller, and it also helps control blood sugars.
Hi, May. Do you have a question for Amy and Shannon?
Hi. What foods do you recommend for diabetics?
In general, with diabetes, what we look at are the carbohydrates and balancing it then with the proteins and those non-starchy vegetables.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C. So talk to your doctor and find out if you have hepatitis C. could save your life. No more.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Jane Mendez, Chief of Breast Surgery at Miami Cancer Institute, and Dr. Lauren Carcas, Medical Oncologist, also at Miami Cancer Institute. If you have a question for Dr. Mendez or Dr. Carcas,